Hey Jenny, we're your backup crew. Can you tell us what's going on?
Oh, hey Jill. Well, poor Sarah has accidentally chopped off her hand whilst cutting some carrots. She's lost a lot of blood, but so far is responding well to treatment.
Oh, okay. Is there anything we can give you a hand with, Jenny?
Thanks. Well, I could use a hand with preparing my final treatment. I just learnt this new technique. I just have to insert some jam through her IV cannula and she'll be good as gold.
Oh my goodness, Jenny. Jam? Why would you do that?
Well, I read about it on the internet and I really think it might help poor Sarah here.
Jenny, you can't just incorporate a treatment into our practice just because you read an article somewhere on the internet. Where did you get the article from?
I read about it on Wikipedia, actually.
No, Jenny, we're meant to follow specific clinical guidelines that incorporate evidence-based practice, not just a random site on the internet.
Oh, I'm sorry. What's evidence-based practice?
Okay, so Hoffman et al. 2013 states that evidence-based practice is essentially the combination of four elements. Simpson, Bendel, Patterson, and Middleton 2012 states that evidence-based practice is incorporating the use of high-quality research evidence with clinical expertise whilst acknowledging the patient and their situation. This may also be shaped by what resources are available. Many people think that evidence-based practice solely uses high-quality research, whereas to completely incorporate evidence-based practice into the field, all four elements need to be unified, states Hoffman et al. 2013. It's all well and good to have knowledge that comes from high-quality evidence, but without experience, being able to utilize resources and working in the best interest of your patient, Hoffman et al. 2013 agrees that the quality of care for the patient reduces.
Oh, I think I get it, but I don't know how this relates to us as paramedics.
Well, for all health professionals, including paramedics, our primary goal is to deliver high-quality, safe care to patients, states Willis and Dalrymple 2019. Low Biondo, Wood, and Haber 2017 state that high-quality evidence-based research provides us with clinical knowledge of anatomy, physiology, and pathophysiology of disease processes and their treatments. Clinical expertise is essentially a paramedic's experience treating patients and becoming familiar with patient presentations with processes such as experiential learning, states McCarthy 2016. If high-quality research knowledge is combined with clinical expertise, this creates the ability to safely care for patients as clinical knowledge can be linked with the patient's history and examination, aiding in excellent clinical reasoning and decision-making. Verona, Rahman, and Amira 2019. A full systematic approach utilizing this clinical knowledge should be conducted on every single patient, states McConnell 2019. Harvey and Kitson 2015 state that evidence-based practice is different for each type of health professional due to the resources that are available to the professional. Evidence-based practice is also dependent on the patient's values and situation, according to Hoffman et al. 2013. Hoffman et al. 2013 also agrees that determining patient preference is an important aspect of paramedicine as it can alter treatment pathways.
Oh, okay, so what's the difference between the Wikipedia article I found and your evidence-based practice article?
Lobiondo, Wood, and Haber 2017 agree that sites like Wikipedia are not legible as anyone can add information and the information is not supported with high quality evidence. I'm not saying that some articles on Wikipedia aren't correct, it's just untrustworthy. Obtaining random research from the internet will not help you stay updated with new evidence-based research or provide you with clinical information, states Hoffman et al. 2013. Unfortunately, there is a lot of research evidence out there that may look trustworthy and in fact have low quality evidence. Hoffman et al. 2013 states that this is why it is important to learn how to critically appraise articles or systematic reviews in order to locate ones with high quality evidence. In order to find good quality research, there are a few steps involved. Firstly, Hoffman et al. 2013 states there are several search databases out there that are of better quality than others. A trustworthy database should be chosen. Minimizing searches to specific criteria is also a good idea, such as narrowing down to only random controlled trials or systematic reviews. Reviewing the selected trial or review and determining whether there is a bias or if the results are statistically significant is also important in finding high quality evidence. Hoffman et al. 2013.
Gee, that sounds like it's hard to do.
Simpson et al. 2012 states that at first it may seem challenging to incorporate evidence-based practice into paramedicine. However, it does get easier once you figure out how the process works. I have only listed a few points on how to appraise research, whereas Hoffman et al. 2013 has step-to-step guidelines on how to complete an appraisal. You may be thinking, how does any health professional have time to appraise all this research? Well, that is where clinical guidelines for health professionals come in.
Oh, so are the clinical practice guidelines we follow based on evidence-based practice?
Yes. Due to constant changes in health knowledge evidence, health professionals need to be kept up to date with high-quality evidence-based research, states Simpson et al. 2012. Simpson et al. 2012 explained that it is difficult for health professionals to keep up with the overload of information, so healthcare guidelines are used to narrow the important information down. For paramedics, we have clinical practice guidelines that are based from high-quality research that give paramedics a guide to patient care, states Hoffman et al. 2013. For example, the Queensland Government 2019 has created clinical practice guidelines for the Queensland Ambulance Service using panels of professionals who have gathered evidence-based practice with the combination of their clinical knowledge to create recommendations for paramedics. These guidelines are constantly reviewed and updated with new evidence. Now that the Australian Health Practitioner Regulation Agency 2019 has enabled paramedicine to become a regulated health profession, there is higher inclination to consistently update clinical guidelines as new high-quality evidence is discovered each year.
Wow, I'm so glad I didn't use my treatment in the end before making sure the article I read was evidence-based. Thanks so much for explaining it to me, Jill.
No worries at all, Jenny. I'll see you later.